I'm a physician. I've been one for some 35 years. As a physician, one faces a lot of ethical problems, but one stands out in my mind. I was a chief medical resident at the University of Washington in Seattle. And, when patients have a cardiac arrest, they call something called a code. And then it's all hands on deck. Everybody comes to the room to try to resuscitate that patient. So sure enough, there was a code, and I went, and there was my team of interns and residents busily resuscitating an elderly man. So as they were working, I said, "Tell me about this patient." "Well, he's 104. 104, yes. "What brought him to the hospital?" "Well, a few days ago, he had car trouble and he was pushing his car to get it down to the garage. And he strained his back. So he took some Advil and he got an upset stomach and he noticed some bleeding in his bowel movements and he came into the hospital." And I said, "What happened to him here?" "Well, he vomited. And then, unfortunately, he inhaled all the vomit, and here we are." So they were prepared to take him to the intensive care unit, put a tube down his windpipe, put him on a ventilator, give him antibiotics, give him medicines to hold up his blood pressure, etc., etc. Now we train our residents in bioethics, but then we didn't. So here I was, the chief medical resident, faced with the likelihood of taking a previously seemingly completely healthy 104-year-old man to the intensive care unit for what would most likely have simply been a week or two of medical torture before he died of many complications. So I looked at them and I said, "No, that's not what we're going to do. We're going to stop right now." They said, "We haven't spoken to any family. We have no consent for that." I said, "It doesn't matter. We're not going to torture him. We're not going to do that. He's had a terrific life. This is it. This is the ending. We stop." So they stopped. The next morning, we had a regular conference with the chairman of medicine, where we told him about all the patients. And at the end of it, he said, "You, stay late. I want to talk to you." I stayed. He said, "Tell me about Mr. So-and-so, the patient of the previous day." I thought I was in deep trouble. I explained this and that. He'd been pushing his car very well up until this point, aspirated, and I said I called off the code. "Okay." I said, "Why did you have me stay after? Why did you call me about this?" "Oh," he said, "I was notified that he was the last survivor of the Spanish-American War." All right, never mind. I think we did the right thing. I think about it sometimes and I wonder, but it seems to me the way to live your life is to make it to 104, push your car when it's stalled, and go out in a big hurry. So I hope we made the right decision. You could ask the question, why was I involved in any moral dilemma here? It sounds straightforward. I think you have to understand that the training of a physician, certainly then and even so now, is to push forward with all means possible to save that life. Now we have hospice, now we have bioethics teams, now we have healthcare proxies. It's somewhat easier, but even so, we see branches of medicine where we don't really utilize these services, and the physician just is single-minded in a pursuit of life, not living, but life. And that was the dilemma for me, whether I was on the right side of that moral question. I, again, think we were.